So India is a huge country. The population is 1.4 billion. So how do we deal with these huge numbers? Next slide, please. The total hearing population of hearing loss is 6.3 million, which is 6.3% of population has a disabling hearing loss. 25 million babies are born annually in India. 10,000 babies are born with a profound hearing loss annually. Out of these, 4 to 6 per 1,000 live births are detected. Next slide, please. So there are huge gaps which we look at. The first one is the ENTs. The estimated available ENTs are about 8,000. The audiologists and speech language pathologists are between 2.5 to 6,000. And the trained habilitation professionals are under 1,000. So you can see here, the shortage is huge. Next slide, please. So the gaps that we see are in hearing screening, early diagnosis, cochlear implant, fitting of hearing aids, mapping, habilitation, and follow-up. Next slide, please. So how do we bridge the gap? We start with newborn hearing screening. So one of the things that we do at our center and through We Connect Foundation, which is a parent support group that we run, we go to different hospitals and we screen babies. We've screened approximately, in the last 1 year, approximately 5,000 babies so far. Besides the newborn hearing screening for babies, we also do adult screening on a very regular basis. Every single month, we're going out there to create awareness, advocate, and screen. Next slide, please. The other thing that we do is, along with all of this, we are skilling community and caregivers. So the hospitals that we work with and other hospitals, we're continually doing programs for the hospital staff. We're working with the pediatricians, we're training the junior pediatricians, creating awareness amongst them, making them understand the importance of newborn hearing screening and the next steps after that. What is a cochlear implant? What is the habilitation that is required? Why early implantation is necessary? We also are training the nurses and parents along with all of this. Fitting of hearing devices as early as possible. So we're fitting them the moment we come to know. In India, unfortunately, we don't always find that babies come to us when they're really little, but sometimes they do. So we fit them immediately with hearing aids and fast track them for a cochlear implant. Next slide, please. And one of the other reasons which is important is not just fitting of the cochlear implant or the hearing aid. What is really required is the exact fine tuning. Many a times we find that the mapping and the programming of the hearing devices is not appropriate. So we're focusing on creating that awareness that every person understands the importance of that. The next thing is the right kind of habilitation. So ABT is something that we do with the little babies, and auditory skills training is what we do with adults. Next slide, please. We do this in person and via telepractice. We believe that we need to reach out to as many people as possible, and we work with people across India and out of India. Next slide, please. Some of the things I've already spoken about. Another thing that we are working with through the Cochlear Implant Group of India, which is the CIICA, is to create a national registry and accountability. We all believe that if we have a national registry, we will understand what the numbers are, and we can therefore go out and do something about it. Health insurance cover is again something that we're working towards. In India, most of the things are self funded. There are agencies, a government is providing cochlear implants free, but there are still huge gaps. There are certain NGOs that are also providing funding. However, as you saw, we have a huge population, and this money and this aid does not reach everybody. Next slide, please. So, what are the key takeaways? Newborn hearing screening and hearing screening for adults is required. Affordable cochlear implants across all ages is again required. Um, Sometimes what happens is only little babies are funded for cochlear implants. What happens to slightly older children who are detected at later ages or adults who require cochlear implants? We need to invest in human capacity building, which is in terms of habilitations, audiologists, rehab, all of that. We need to develop a data system for follow up and outcomes and strengthen the public private partnerships. Next slide, please. We need to all think beyond numbers. We need to let every single voice be heard. Let's move away from counting numbers to creating impact together. Thank you so much.